Type 2 diabetes is treated in every region of the world, but the treatment experience can look very different depending on what country you live in, what medications are available, and how the health system is built. People often hear diabetes treatment described as if there is one universal pathway. There is not. The core goals are similar almost everywhere: lower risk, improve glucose control, protect the heart and kidneys, and make the plan sustainable enough for real life. But the route into treatment can differ a lot. Some health systems emphasize primary care first. Some rely more heavily on specialist clinics. Some countries have wider access to newer medications, glucose monitoring, or structured education than others. Once you see that difference clearly, the conversation becomes less about one perfect protocol and more about what good treatment is actually trying to accomplish under different real-world constraints. Across countries, type 2 diabetes treatment usually rests on the same backbone. Help the person understand what is happening metabolically. Improve blood sugar control safely. Reduce long-term complications involving the heart, kidneys, eyes, nerves, and blood vessels. Support weight management when that is relevant. And build routines that can actually be repeated. Lifestyle support, medication monitoring, and follow-up all show up in different proportions depending on the system. But those goals stay recognizable, whether you are looking at care in the United States, the United Kingdom, Canada, parts of Europe, Latin America, Asia, or lower resource settings. Imagine 3 people with similar A1C levels living in different countries. One gets quick access to a structured diabetes program and a dietitian. One gets medication but very little education. One has to navigate long waits, lower medication choice, and irregular follow-up. Their treatment plans may look different on paper, but the most important question stays the same. Does the plan actually help them understand what is being tracked, what the medication is supposed to do, and what signs would show the plan is working? Good care is not only about the prescription. It is also about whether the person can follow the logic of the treatment. The differences often begin with access. In some systems, metformin and older low-cost medications are easy to obtain, while newer drugs like GLP-1 receptor agonists or SGLT2 inhibitors may be harder to access because of price, shortages, coverage rules, or local formulary limits. Some countries have wider use of diabetes nurses, educators, dietitians, and structured classes. Others put more of the burden on short primary care visits. Continuous glucose monitors may be common in one place and unusual in another. Even lab timing, referral pathways, and follow-up routines can change. But the key goals, understanding what is happening metabolically, controlling blood sugar, and reducing complications, and how quickly someone gets eye screening or kidney follow-up can vary. That does not mean one region cares and another does not. It means treatment happens inside very different systems with different constraints. When treatment works well across different systems, a few things usually show up. The person understands the diagnosis. The care team is tracking the right labs and complications. Medication is chosen for a reason instead of by confusion. Education is practical rather than abstract. The person knows what to do next instead of just hearing that diabetes is serious. Those common elements matter because they let viewers judge care quality more intelligently. The exact medication list may differ. The exact insurance or national health structure may differ. But clear goals, follow-up, education, and sustainable action are recognizable almost everywhere. If you are trying to understand your own treatment in context, ask better questions. What numbers are we tracking and why? What is this medication expected to improve? What lower-cost alternatives exist if access is a problem? What screening is due next? What support exists in my country or region for diabetes education, nutrition help, or medication assistance? If you follow diabetes information online, always ask whether the advice assumes a different health system than your own. That one habit can save a lot of confusion. Type 2 diabetes treatment is global, but treatment systems are not identical. The details differ, the access points differ, and the constraints differ. The deeper structure is what matters most. Understand the pattern, reduce risk, build a sustainable plan, and keep adjusting based on real follow-up instead of guesswork. If this helped you think about diabetes treatment more clearly, subscribe to the Metabolic Keys and comment with the country or treatment system question you want broken down next. If this made the topic clearer, like the video, subscribe to the Metabolic Keys, and comment with the treatment, question, or interpretation you think matters most for real-life decision-making.